Many cat caretakers don't realize it, but some of the things that they are doing to help their cats with chronic kidney disease could actually be causing harm. Let's talk about what you need to watch out for. If you're new here, welcome! I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the videos so I can create more content like it. There is no doubt that caring for a chronic kidney disease cat can be very overwhelming. You're bombarded with advice from all directions, and it's difficult to know what's correct. But the truth is, chronic kidney disease, or CKD, is a very individual process, and what works for one cat might not work for another cat. In this video, I'll walk you through some common mistakes or misconceptions that cat caretakers make so that you can avoid them and feel confident in your cat's care plan. It's natural and normal to want as much advice as possible when your cat is first diagnosed with CKD. But here's the problem. Not all advice is good advice. Every CKD cat is unique, and what works for one may not work for another, or it may not even be necessary for that cat. For example, if your cat's blood phosphorus level or FGF23 isn't elevated, your cat may not need a phosphate binder. Or if your cat's non-anemic, they definitely don't need a medication to stimulate their body to produce more red blood cells. It's important to know where your cat is in their journey and treat them as individuals. Online forums and social media are filled with well-meaning but conflicting advice from who knows who. Always make sure you filter any advice you're given through your veterinarian, the one that has laid hands on your cat, the one that has spoken to you directly and knows what's going on. And ask yourself, is this advice based on my cat's specific stage of CKD and their health history? Advice should never be given or taken based on one random set of blood values that you may post online, or without the entire clinical picture. And one of the biggest areas I see where misinformation can be harmful is around nutrition. For CKD cats, food should be considered medicine. What they eat directly impacts their kidneys, their health, and their overall well-being. Unfortunately, some cat caretakers resist therapeutic kidney diets, either fearing that their cat won't like them or because of some misinformation they heard online. And while these therapeutic diets aren't always necessary, they really can be a game changer when it comes to managing your cat with CKD. Science has repeatedly shown that high protein, high phosphorus foods will damage the kidneys, and kidney disease will progress because of it. Now, that doesn't necessarily mean you need to be feeding your cat a low protein food either, but you need to take your cat's individual nutrition into account. We want to prioritize things like phosphorus and sodium control, hydration, high quality proteins, and potassium and omega-3 supplementation. For cats that will eat appropriate foods, that may be the only thing you need to do for them for quite a while until their disease progresses, if their disease even progresses. Nutrition really can be a very important point with these cats. However, the worst thing you can do is let your cat go without eating. Cats, unfortunately, will starve themselves to death. If they don't like the taste of the food, the texture of the food, the smell of the food, if they don't recognize it as food, they will absolutely refuse to eat it. And above all else, keeping your cat eating is the most important. It's incredibly important to find the right food for your CKD cat. On the flip side, force feeding your cat or syringe feeding your cat is going to do more harm than good, so just don't do it. I totally understand that it's heartbreaking where your cat is refusing food, and you might think force feeding is the only option, but it actually can make things much worse. I mean, really, put yourself in their shoes. Would you want someone coming at you with a syringe, pinning you down, and forcing it down your throat? I don't think you do. Force feeding can create food aversions, and it's stressful for everyone involved, even if your cat seems to tolerate it. It's also incredibly rare that you're going to get enough calories into your cat by force feeding them to make it beneficial. If your cat won't eat, we need to figure out why. That's the key. Are they nauseous? Are they painful? Do they not recognize what you're trying to give them as food? What is going on? The answer to that why is how we are going to solve this problem. And instead of force feeding, try appetite stimulants, try nausea medications, try warming the food, try hand feeding them small amounts of food. And yes, when necessary, feeding tubes should be considered. I know this is a subject that some people have a pretty significant aversion to, but honestly, having been in this field for so long, I'm kind of starting to think cats should just come with feeding tubes. You can feed them what you need to feed them. You can get as much water into them as you need to get into them. You can medicate them through the tube. They really are handy things. It's a little bit different mindset than when we put feeding tubes in humans. When we put feeding tubes in humans, at least late in life, it's usually an end stage process. With cats, particularly our CKD cats, the goal is to keep them eating or keep nutrition in them until we figure out why and what's going on and how to solve it. While feeding tubes can be a permanent thing, they don't have to be a permanent thing. However, I do understand that the concept of a feeding tube may be considered too much for some cat caretakers. And while I'm on the subject of too much, let's talk about over-medicating and unnecessary supplements. More medication isn't always better. In fact, too many medications or supplements can actually strain your cat's kidneys further or their liver. Most of the things that we give to our cats are either processed by the kidneys or processed by the liver. They don't just take them and then they just magically work. They have to be processed through an organ. And we need to keep that in mind when we start adding in extra things. Are we actually putting stress on the body rather than fixing a problem? CKD cats, and some cats in general, can have very delicate systems, and too many medications or supplements can upset this very fine balance. Most things given orally come with a risk of vomiting or diarrhea or cramping or even constipation. Those side effects alone can lead to a poor appetite. And this applies to medications and supplements. Just because something is labeled a supplement does not make it safer than a medication. In fact, oftentimes supplements aren't studied to the point that we actually know what their side effects are. It can be a gamble. And if you can't give these medications and supplements to your cat easily, and you have to mix them in things like food, you again risk creating a food aversion by mixing multiple things into a food that you may want your cat to be eating. Always ask, is this necessary? Is there evidence that it helps CKD cats? There's so many testimonials out there for so many different things, when in reality, a testimonial is the lowest form of proof that a product is safe and works. When it comes to treatment, you really want to focus on the core essentials: hydration, phosphorus control when needed, nausea management, pain control, before you add in extra things. And if your cat is taking multiple medications and supplements, review them regularly with your veterinarian to make sure you're not doubling up on something or you're giving something that you don't need to because of a change in the disease state or stage. And on the opposite end of the spectrum, some cat caretakers just simply give up. They assume CKD is a death sentence. Fortunately, these days, CKD doesn't have to be an automatic death sentence. While most cats can't be cured, we can manage them, and many are living months, if not years, of quality life with correct management strategies. Those small daily actions of maintaining appetite, hydration, and just regular monitoring can make quite a bit of difference. Don't let fear or misinformation stop you from trying to take proactive steps and help your cat with CKD. And speaking of proactive steps, another common mistake or misconception I see is seeing that your cat's doing well. We don't need to go to our regular veterinary visits. Your cat may seem stable, but CKD can progress very quietly. Regular checkups help you stay ahead of this disease. Because you spend the day-to-day with your cat, you don't always see the really minor changes that happen that your veterinarian can see when they see your cat on an individual basis. They'll look at their weight, they'll look at their hydration, they'll look at their coat maintenance, they'll look at their muscle mass, they'll look at all of the things from an objective standpoint rather than your daily subjective standpoint, and they may be able to help point you in a better direction. Or the regular monitoring of blood work and urine can be hugely informative as to what's going on with the kidneys and the current stage of disease they're in. Catching changes early means better outcomes and far fewer emergencies. And I get it. Not every cat likes going to the veterinary clinic. I have a few of my own that it is not their cup of tea. But if that's the case, talk to your veterinarian about making these visits less stressful. Whether it's coming to the clinic with medications on board, whether it's finding a local veterinarian who does house calls, there's lots of options out there, but you have to have that conversation. You have to let your veterinarian know about your concerns, the concerns your cat may have, and together you can make a plan to get them in for their regular monitoring. I really encourage you, even if your cat seems fine, and that's a great thing if your cat seems fine, make sure you have a follow-up plan and you stick to it. Now, medical care is only part of this equation. We also have to take stress into account because daily stress can play a big role in how your cat does in the long term. A calm, comfortable cat is definitely a healthier cat. You may not think of it this way, but the stress hormones that are produced by the body actually have negative effects on the rest of the body systems. So make sure you keep your cat's routine as predictable as possible. Cats thrive on routine. Cats that don't feel good really thrive on routine. Provide quiet spaces, familiar bedding, gentle interactions. As I mentioned before, if your cat gets easily stressed when you're giving medications or supplements, really evaluate, does your cat need these medications and supplements? What are they for? What is the goal? Are they working? Are they not working? And how is it impacting their stress level? If we're trying to provide the best quality of life, we certainly don't want our cats running from us constantly or hiding under the bed or avoiding us because of the treatments we're providing for them. And yes, your own stress level can affect your cat as well. So it's very important that you take care of yourself. Stay calm, stay focused, and focus on what you can control. If you've made any of these mistakes, don't worry, you're not alone. Many of us have been there too. The important thing is to learn from them and move forward. The good news is, now that you know what to look for, you can make small changes that will impact your cat's health and happiness. If you found this video helpful, be sure to subscribe for more CKD cat care tips. And for a more complete look at mistakes to avoid, check out my free PDF, 5 Mistakes to Avoid When Caring for a Cat with Kidney Disease, with the link below in the description of this video. See you in the next video.